Hello everyone. In this video, I'm going to tell you about a heart condition called hypertrophic cardiomyopathy. If you're new to the channel, I'm Hafiz and I'm a cardiologist training in London. Here I explain heart conditions in a way that is easy to understand, and I also provide teaching for medical students and junior doctors. If you want to know more about your heart and how it can be affected, then hit the subscribe button and bell icon so you get a notification every time I post a video. Okay, so let's get right into it. I think the first thing to say is that most people with hypertrophic cardiomyopathy have a good quality of life and a near normal lifespan. It is a genetic condition, meaning that is something you are born with, and it can be inherited. So if one of your parents has the faulty gene for hypertrophic cardiomyopathy, you have a 50-50 chance of inheriting that faulty gene too. In fact, hypertrophic cardiomyopathy is the commonest genetic heart condition affecting 1 in 500 people. Hypertrophic cardiomyopathy, or HCM for short, literally means thick heart. The medical term for a thick heart is hypertrophy, and in this case, left ventricular hypertrophy. In your heart, you have 4 chambers, the left and right atria and the left and right ventricles. The left ventricle is the chamber which pumps blood around the body. Normally, the wall of the left ventricle should be up to around 1 centimeter. If the wall of the heart is thicker than that, then it's considered to be hypertrophied. And this is a problem as the left ventricle cavity reduces in size, so it can't hold as much blood, so the heart has difficulty filling with blood and needs to work harder. The heart also becomes scarred and stiff, making it difficult to pump adequate amount of blood around the body. HCM can be non-obstructive or obstructive. In obstructive HCM, there is no obstruction to flow of blood out of the left ventricle. In obstructive HCM, the thick wall of the heart bulges into the path where the blood leaves the left ventricle, called the left ventricular outflow tract. This also affects other structures within the heart, like the mitral valve, which can get sucked in to the outflow tract, narrowing the outflow tract further and preventing closure of the mitral valve, causing leaking of blood back into the left atrium. Symptoms of HCM with or without obstruction include tiredness, breathlessness, lightheadedness, palpitations, or even passing out. HCM is diagnosed when all other causes of a thick heart are excluded, like high blood pressure or a valve disease. HCM is underdiagnosed as people can have no symptoms, so they just don't get investigated. It's usually after a symptom that people get diagnosed or through family screening. The investigations for HCM is firstly a good history and clinical examination. The first test is an ECG. In HCM, the ECG is almost always abnormal. I don't say never because there may be exceptions, but it is very rare to have a completely normal ECG in this condition. Typical findings on an ECG are patterns of left ventricular hypertrophy, such as T-wave inversion, and changes in the ST segment. The next step is usually an echocardiogram, which can tell us the pattern of HCM and if there is evidence of outflow obstruction. But sometimes it can still be challenging to diagnose, and if the index of suspicion is high, then the next test is a cardiac MRI scan. Cardiac MRI is almost like having a biopsy. We can review the tissue integrity of the heart and see if there is any evidence of scar. HCM is associated with heart failure, atrial fibrillation, and stroke. Treatment depends on symptoms and risk of sudden death. And this is the reason why we worry about HCM, is that it can cause ventricular arrhythmias, which is a dangerous heart rhythm and therefore lead to sudden death. This isn't very common, but the risk does increase in HCM. This is unpredictable, but preventable with a cardiac device called a defibrillator. We risk assess for sudden death by considering family history of sudden death, the degree of heart thickening, and if there have been any fainting episodes, to name a few of the risk factors. Usually we start with medical therapies such as beta blockers and reassess if things change. There are also surgical treatment options such as a myomectomy or ablation to reduce the thickness of the heart muscle. So to summarize, hypertrophic cardiomyopathy is a genetic heart condition causing thickening of the heart muscle, which can lead to dangerous heart rhythms leading to cardiac arrest. Most people with HCM lead a normal life and symptoms can be managed with medications. I hope that was helpful, and thanks for watching.